Administering an IV injection demands precision and adherence to medical protocols to ensure patient safety and effectiveness. Each step, from meticulous hand washing to precise documentation, is crucial. Proper protocols help prevent complications such as infections, incorrect dosages, and vein damage. They are the backbone of successful IV administration, ensuring that each procedure is not only effective but also safe for the patient. It's the meticulous attention to these protocols that can make a significant difference. Remember, the safety of IV injections begins with a strict adherence to established medical protocols. Every successful IV injection starts with thorough preparation. First, it's crucial to wash hands meticulously with soap and water or utilize an alcohol-based hand sanitizer, ensuring a sterile environment. Next, gather all the necessary equipment: the IV catheter, sterile dressing, IV tubing, and the medication prescribed. It's imperative to check the patient's medical records to confirm the prescribed medication, its dosage, and any potential allergies. This step is vital for safety and efficacy. Moving on, clearly explain the procedure to the patient, ensuring they understand what to expect. This helps in easing any anxiety. Finally, position the patient comfortably, typically lying down with the arm extended and the palm facing upward. Proper preparation not only streamlines the procedure, but also builds trust and comfort with the patient. Selecting and preparing the vein are critical steps that require careful attention. Begin by assessing the patient's veins, focusing on the forearm, hand, or the antecubital area, which is the bend of the elbow. Look for a vein that is both visible and accessible, ensuring it's suitable for the intended therapy. Once a suitable vein is identified, apply a tourniquet a few inches above the insertion site. This helps make the vein more prominent, easing the insertion process. Next, meticulously clean the chosen site with an antiseptic solution. It's crucial to let the area dry completely to prevent any potential infection and ensure a sterile environment for the catheter insertion. These steps ensure the vein is optimally prepared for the insertion, minimizing risks of complications. Inserting the IV catheter is the culmination of all prior preparation. Begin by holding the catheter at a slight angle, between 15 to 30 degrees relative to the skin. Insert it into the selected vein with a swift yet controlled motion. Watch for a blood flashback in the catheter, which signals successful venous entry. Once observed, advance the catheter slightly further, then remove the stylet or needle. Next, secure the catheter. Stabilize it with one hand while using the other to apply adhesive tape or a securement device. This ensures the catheter stays in place. Attach the IV tubing to the catheter hub, checking for a secure connection. Proceed by flushing the catheter with a small amount of sterile saline. This step confirms proper placement and functionality. Now, start the infusion of prescribed medication or fluids, adjusting the flow according to the prescribed rate. Monitor the patient closely for any signs of adverse reactions or complications. After the procedure, responsibly dispose of all used materials and sharps. Apply a sterile dressing over the insertion site to prevent infection and ensure cleanliness. Document every detail of the procedure, including the medication type, amount, and the patient's response. Following these detailed steps ensures a safe and effective IV injection, emphasizing the importance of protocol to protect and treat patients effectively.